So what do when the back pain that you normally put down to overexertion, or when you admit it, that you're getting a bit old and creaky, just doesn't get better? A good friend of mine referred me to Dr. Peter, as he called him. He's like a magician. So here I am with Dr. Selvaratnam. He's applying tape to take the pressure off the sciatic nerve, and this allows the inflammation to settle down and for me to get some pain relief.
Hi, I'm Dr. Peter Selvaratnam. I'm a specialist musculoskeletal physiotherapist and also an associate clinical professor. I'm applying on Martin the gluteal taping technique, which was first really devised by Jenny McConnell, who's well known in Australia and all over the world. So the sciatic nerve runs in this distribution down the leg. So what we're doing is to take the pressure of the sciatic nerve, and more importantly, we are supporting the gluteal muscles, because when stands, the pressures don't go into the gluteal muscles or the sciatic nerve. The pressure, the tension is taken by the tape.
Right, so the pressure is to pull the glutes upwards and out, is that right?
That's right. Ingredients we need is the skin prep. Then we put the white tape called Hyperfix, and then the brown tape called Leucoplast. Generously spray the skin prep.
And it's just alcohol.
The alcohol plus it has ingredients to stop the skin getting itchy.
Oh, right.
And make sure it dries first. So you can want to be quick. So there's a similar tape we use on Olympians and our footballers to get them play yesterday.
Right. Can I get that spray at a regular chemist? Or?
Yeah, the chemist downstairs should have, you know.
Oh, okay. Yeah.
If he doesn't have, we've got 1 or 2 for patients, you know. So next with the tape, I'm going to put anchors here,
Yeah.
so the skin doesn't get itchy. So got 1 anchor. I'm going to apply 2 tapes here. So the idea of the tape is like a triangle. I'll apply 2 like that, 1 across and 1 across there.
Does this particular type of taping have a name? Because there's, when I looked it up on Google, there's like lots of different ways of taping, and it's hard to figure out what's
Yeah, the names of the tape are given there. It's on the opposite side of the page.
right.
So skin prep is the first one. Then in the list are given at the back of the.
Right.
It's called Hyperfix.
Yeah.
There's another one called Fixamol, but Hyperfix is better on the skin. So these tapes are hypoallergenic, you know.
Right.
So these are the anchors. Then I apply the white tape. Ensure that you take little at a time, otherwise it gets caught in your hand. Then I place it here.
And it's just pulling
Just place
it
it.
up.
So initially I don't pull it up.
Yeah.
I just lay it on.
Yeah.
So take little at a time. So take little at a time. Just lay it on.
Yeah.
So take little at a time. Just lay it on.
Yeah.
And I use next set of tape, and I'll go sideways to the gluteus medius muscle. Another one also to support. Second one.
Right. So the white tape doesn't need to hit the.
Doesn't have to have too much, yeah.
At all.
For somebody doing the first time, the tension part, they'll find it hard to pull it. One, you can put a bit of tension, but the brown tape is very good, the tension.
Right.
So this is a brown tape, you put more tension. So you first lay it on, and with a scissor, you cut it,
Yeah.
and then you hold the edge here and you pull up.
Right.
And make sure it doesn't touch the skin.
Right.
A bit of tension, but the brown tape is very good, the tension.
Right.
So this is a brown tape, you put more tension. So you first lay it on, and with a scissor, you cut it,
Yeah.
and then you hold the edge here and you pull up.
Right.
And make sure it doesn't touch the skin.
Right.
Another one here. I'm a little fast, so I rip it off, but you can use the scissor. The next one goes sideways. A bit of tension there.
So you're pulling out.
Pulling outward, that's right. Okay, pulling outwards. So I'm already putting the tension and pulling like that. This one.
Oh, so that pulls in.
That pulls in here.
Yeah.
So the sciatic nerve travels like that, so it really supports it here.
Yeah.
And it changes your biomechanics also.
Yeah. Okay, that makes sense. So the tape lifts and supports the muscles in the buttocks. After applying the skin preparation, apply the white anchor tapes, followed by the brown tape to apply tension. Pull up on the gluteus muscles, then sideways, and then finally pull the top inwards. This relieves the pressure inside the triangle. This is confusing. Some videos on YouTube sort of have the tension outwards, and some have them inwards, and they didn't really explain the reason.
Tension upwards,
Yeah.
tension sideways. This one I pull it in so it gets the pelvis in a better position.
Right.
Yeah. We use it for patients who have sciatic pain, who need support in the gluteal region, and also in some patients who might have pain that is in the calf but have poor stability. Now, people ask me, why do you use it? The engineering principle is that forces go to the stiffest area. So instead of going onto the muscles or the nerves, what tends to happen is it goes to the tip. And biomechanically, it also helps patients to move a bit differently with also the support. Now, it's important that the patients don't have any irritation to the skin. If they have any skin problems, you should not avoid it. If they got very fragile skins, avoid it. If they say that they are hypersensitive, that will be also contraindications. It's important that you apply skin prep liberally, and then put the hyperfix or the fixed the white tape, and then the brown tape called leucoplast.
Are there any sorts of sciatic pain conditions that this isn't really useful for?
Well, with most sciatic pains, because the sciatic nerve travels through the pyriformis, it supports that area, and it will help to take some of the tension of the muscles and also change the biomechanics.
Yeah.
Sometimes patients with spinal canal stenosis respond to it, but sometimes when they're walking, they might find that they might change their biomechanics and can aggravate it. So you need to take it from patient to patient. In that case, we might do tapes in the thigh or the leg or the feet to change the biomechanics. So it's appropriate for certain patients, but if it doesn't work, you need to try other things to change their biomechanics. So really, you're looking at assessment and reassessment, and looking at, does it change their function? So we've helped patients who the orthopedic surgeon, neurosurgeon sent here to see whether they can avoid surgery, and 9 out of 10 have been helped by it. Of course, some patients, if the skin is a bit irritable, it's a bit hard. Other aspect is if they have nobody to do it. But like some wise patients, they got the Royal District Nursing Association to help them.
Okay, thank you very much. And some have them downwards, and they didn't really explain
Yeah.
the
So
reason.
tension upwards,
Yeah.
tension sideways. This one I pull it in so it gets the pelvis in a better position.
Right.
Yeah?
Okay.
So I'll just write the other exercise for you in a moment.